The seated exercise for your back is to move the joints in your lower back to maintain the motion restored by treatment and to allow the joint time to heal. Your first movement is to arch up and roll back. Again, bend forward, pull into your legs as long as it doesn't cause pain, and then roll back up. We're going to isolate the motion. Alright, so let's do this one more time. Roll your hips up. Roll your hips back. Good. Once more, roll your hips up. And roll your hips back. Now the next motion is bending forward. We're going to do the bending forward now, separated and isolated. We're going to roll forward. Again, you can pull into your legs as long as it doesn't hurt, but if you have pain, just go as far as you can comfortably. Then roll back up. Again. Now, if you watch how she came up this time, this is incorrect. So you don't want to pull your shoulders up first and get into an arched position as you come up, and that's the reason to show you that. So you don't want to go down with your back arched forward. So again, don't do these movements incorrectly, and this can be confusing, but I want to make sure you know not to do it the wrong way. This is another thing that people do a lot. Don't drop your head before you bend forward. Keep your head straight, like you're looking straight ahead, and then come forward. So this is incorrect. Do not do it this way. Okay. So again, see how she straightens her back out and she pulls her head back and loses her position. So you don't want to do it that way. Okay. Too flat. So let's look at the correct way. Good. So for sitting position, you want to make sure your head and shoulders are over your hips, and then you roll back into the seat nice and comfortable. Okay? So back and into the chair, head and shoulders relaxed over your hips. So exercise. Roll your hips up, roll your hips back, bend over, and then roll back up into the chair correctly. That's the correct way to do your exercise, and this is how you want to do it. All right? Work on those. Maintain that motion. You'll do well.